Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access at stepsforward.org.
Hello, and welcome to this episode of the AMA Steps Forward podcast series. This is your host, Si Chen, Physician Director of Practice Sustainability here at the AMA. To date, much of the focus for integrated care has been on the primary care setting. That's understandably so, given the clear need for holistic approaches to the care of their patients. The importance of whole person care, however, does not stop at the primary care door. Other specialists, such as cardiologists, also help manage patients with chronic illnesses who have increased risk of exacerbating existing or developing new co-occurring behavioral health conditions. To discuss opportunities for more patient-centered integrated care for cardiovascular disease, I'm joined by our guest, Dr. Kim Smolderen, a licensed clinical psychologist and outcomes researcher, associate professor of medicine and psychiatry at the Yale School of Medicine, co-founder of the American College of Cardiology Cardiovascular Psychology Workgroup, board-certified health and wellness coach, and a recognized expert in vascular disease. Thank you so much for being here today, Professor Smolderen.
Thank you for having me on this podcast. I'm really excited to talk about this topic. It's shaped my career so far, and I live and breathe this topic in my day-to-day work. So thank you.
That's wonderful. Before we get started into all the other topics, would you mind telling our listeners a little bit more about yourself and your background?
Of course, yes. So I'm a professor of medicine and psychiatry at Yale School of Medicine, which I have been in that position since recently, but at Yale for the past 5 years. And I co-lead a research lab with interventional cardiologist Carlos Mena and our multidisciplinary group. I do a little bit of clinical work, and my focus is on cardiovascular populations and the intersection with behavioral health and how that impacts their risk as well as their outcomes, and how we can translate those insights into care innovations and integrated care programs. I'm originally from Belgium, trained in the Netherlands, did my postdoc with the American Heart Association, and I am also since recently a yoga instructor and try to integrate more of the mind-body practices also in the research work that we have ongoing, as I feel like there's a strong need to integrate the mind-body balance in cardiovascular diseases because a lot of patients come to us to manage stress-related questions, sleep-related questions, etc. So yeah, those are the areas that I work in and am interested in.
Wow, you have such a varied and broad background. It sounds like you can bring together a lot of different experiences and expertise into very complex situations, such as caring for patients with cardiovascular conditions.
Yeah, I was fortunate to be trained in a group in the Netherlands that specialized in medical psychology and cardiovascular disease in particular. My mentor at the time, he was studying the interaction between personality and heart disease, and he has shaped a lot of the work and interests that I'm doing today. And then added to that is really the focus on outcomes research, which I learned through the postdoc and at the Mid-America Heart Institute in Kansas City, where I spent about 10 years of my professional life, where I learned really how to translate back the insights on how behavioral health affects the risk, the outcomes, but also how to think critically. What does that translate to in the offerings of care that you need to make an impact on outcomes, not only from the quality of life and the mental health perspective, but also the clinical endpoints, and how does it fit into the whole system of healthcare, because it's complicated, it's layered, it's not just connecting people with mental health resources. So it's much more complex than that. So that allowed me to develop that broader framework of risk, but also think about advocacy and how to translate it back to the care setting.
Yeah, I like how you sort of tied in, outcomes-based research, bringing that to the complex clinical situation and then also following in with advocacy. So I think that's very important. Before we dive into a lot of those issues, I'd like to take a step back and just sort of talk to our listeners about, your views on how mental and behavioral health conditions like depression and anxiety, along with other behavioral health risk factors such as chronic stress, how does that impact, your patients with cardiovascular conditions, things like coronary artery disease, peripheral artery disease, and what can organizations do to better integrate behavioral health to establish more whole person care for their patients?
Yeah, so I feel like stress is something that affects all of us in some degree, and having the right coping resources and the balance to deal with those is key to maintain good physical and mental health. And what we often see in cardiovascular disease or people with risk factors is that stress, and particularly exposure to chronic stress, creates an imbalance in our autonomic nervous system function. The function get more swayed towards the sympathetic overactivation, and that has downstream effects on many cardiovascular function metrics and systems. And you will have effects, for instance, on insulin resistance, hypertension, inflammatory response, platelet activation, endothelial dysfunction. Those are all mechanisms that have been linked to this imbalance of the sympathetic nervous system that people might experience when they have chronic exposure to stress. And then especially when they are introduced to acute stressors in their day-to-day life and they have that chronic exposure in the background already ongoing, those stress responses may be amplified as well. And then when people experience depressive symptoms or anxiety, we also have effects on how well we keep up with our lifestyle behaviors, how well we eat, how well we sleep, exercise, and that seems to like take a back seat if people are distressed. So that also indirect has implications for people's cardiovascular health. So those are the most studied mechanisms through which chronic stress and depression and anxiety might interact with the cardiovascular disease, both for the incidence of disease, but also the progression of disease is what we notice.
Thank you for highlighting those, common, well-known sort of factors in either incidence or progression as it stands where mental and behavioral health conditions can affect cardiovascular disease. I want to move a little bit into sort of the research side of things. I know those that you talked about are common, but what are some of the more surprising or impactful findings from some of these leading research efforts focused on developing an evidence base for integrated whole person patient-centered care? And how are they now shaping the future of cardiovascular disease management?
Yeah, I think the established evidence base has focused mostly on the risk factor depression and how that can be addressed in a collaborative care program integrated often in primary care. And now more and more those programs are also introduced into specialty care, and the evidence around it is solid. It improves both mental health, but also the cardiovascular risk metrics that we all like to see improved: better diabetes control, better adherence, and also a reduction of the care consumption after. So that's pretty solid out there. What we now also see happening, and this is for me personally also an area of interest, is trauma informed care. Because a lot of the individuals affected by cardiovascular disease, if there's pre existing psychological trauma, that already is an alteration of the nervous system that may be in place that has that overactivation of the sympathetic nervous system. And so looking through that trauma informed lens is a newer way of designing care programs and seeing how those treatments to address that in the context of cardiovascular disease impact cardiovascular outcomes, I think is an exciting area of development.
Yeah, how does that play into your work with the American College of Cardiology, that cardiovascular psychology work group? How are you all building on these findings that you've mentioned?
So, with that work group, which is pretty unique within the American College of Cardiology, because it has representation of the several subspecialties in cardiovascular medicine, both from cardiologists as well as behavioral health specialists. And we have focused on raising awareness amongst our colleagues and writing a few key papers. And the last one that we worked on, and which is going to be published soon, is individuals with ICDs and the impact of sudden cardiac arrest survivors and the impact on mental health. So that has been our focus, to raise awareness, but also to think about pathways for integration in those different subspecialties and tied to the clinical pathway that people are undergoing for their cardiovascular treatment and how to build that in. So that's what we've focused on, and especially in that ICD population, the role of PTSD and trauma is very prominent, as they may experience shocks, and sudden cardiac arrest survivors also may suffer from that. So more evidence-based implementation work, I would say, is necessary to really apply it in the clinical care pathway and see how that then impacts the outcomes of patients.
Yeah, it sounds like you all are doing really important work to establish that foundation for dissemination of all this information that you've gathered through research, through collaboration. And I think that's really going to be impactful. I know, we're not necessarily just starting, but it's still sort of young, and all of these things that we can do to help sort of combine both the behavioral mental health side and the physical medical side of things, I think will really help our patients in the long run. So appreciate that, and thank you for all of that work that your group is doing. Switching gears a little bit from that sort of holistic organizational level of work that you do, I want to get a little bit more into the individual interactions that you've had in your clinical role. You said that you still do some clinical practice. What have been the most important or fulfilling interactions when you're collaborating with your cardiology colleagues, when you're caring for these patients with cardiovascular conditions?
Yeah, here at Yale, our integrated behavioral health clinic for the Heart and Vascular Center just kicked off this past year. It has been in the works for some time because it needed alignment between the different departments where cardiology is housed, but also where psychology is housed, and that's under the Department of Psychiatry. So, leading up to the start of that, I think we learned a lot from each other, how care is organized and how we make it sustainable. And now that it is finally happening, I feel it's very rewarding. And also from the perspective of being able to share what cardiologists have been struggling with particular patients, where they spend a lot of time counseling the patient on social determinants of health, or the anxiety that they're dealing with. And now they finally have a referral path for introducing them to evidence-based care, and seeing that even short behavioral interventions have significant effects on their anxiety relief, their stress relief. Seeing those results and discussing that with the referring provider has been, a very new experience that, we all learn about our fields and how we can really make the patient feel better. And so that's been really rewarding to see and experience.
Yeah, I'm a radiation oncologist, and I had the great privilege to work in a co-location model where I had resources at my fingertips to reach out to psychiatrists, psychologists, and our colleagues. And it was very reassuring for me as a specialist, and not just, I didn't deal with some of these patients in the primary care setting, but we did see them quite often in follow-up, in survivorship. To have that resource, I think, is definitely a benefit to those practicing physicians, but inevitably it's going to be a huge impact to our patients. I kind of want to ask you if you have like a story that you can think of that in this sort of location model, what was something that stuck in your mind that, wow, I made an impact because we have this location model?
Yeah, I like every individual patient's story teaches me something new. And you see patients dealing with status post cardiac surgery. Often they might still be very young and having multiple responsibilities in their day-to-day life and anxieties on how they are going to keep up with those responsibilities. And then you discuss with them like what have they been doing before in managing their stress and dealing with those. And people may not be aware about mindfulness-based interventions or how to like apply cognitive restructuring and really apply it to day-to-day situations. And you teach them how to do it, and then they go practice with that, and they come back the next session and they almost, you could not have imagined how like enthusiastically they have applied it in their day-to-day situations, and you see them making progress and being excited to take charge of their thoughts and how they create that space for themselves to center and actively come up with coping strategies to manage their stress. So for me, that's very rewarding, but also like I'm glad for these patients that they are now having practical tools in their toolbox to deal with managing stress. And then we also get a lot of referrals from people in the preventive cardiology clinic who may not have gotten their heart attack or surgery that they have had. And so they're seen for preeclampsia, hypertension, all those metabolic risk factors. And so knowing that there too, you introduce evidence-based behavioral interventions to reduce depression, reduce anxiety, address trauma, and they're improving. And hopefully this will contribute to the prevention of at least the contribution of stress to cardiovascular disease and helps them to optimize their prevention plan.
Great. That's really heartwarming and uplifting to hear that, you come back the next session and the patients have already started to implement what you've taught them. And it's, you can see a definite change. So that's really, very impactful, I think, to see that. And for, the physicians that are listening, I'm sure that resonates with them as well.
I would add, oftentimes, this is the first time in people's life that they've seen a behavioral health specialist, a psychologist, talked about their past trauma. And that in itself seems to be having a really profound effect on being able to just talk about it and not bottle it up. So I've heard that several times that this was the first time they actually talked about this. And we are co-located in the clinic, meaning that they would walk into their cardiac ambulatory clinic as they would for the psychology sessions, as they would for their cardiac sessions. So it feels the same and one as part of one of their overall treatment. So I feel like that takes the stigma away also, which I think is important.
Yeah, absolutely. I think that's a great point that you make. It's great to hear that this may be one of the first touch points that patients have with mental and behavioral health intervention. But that stigma. I wonder if you've ever come across patients that are a little bit more skeptical or kind of don't want to see you. But at the end of the day, when they talk through and walk through with you, is there that change that there's that more openness that they have to receiving intervention?
So I think if there is any hesitation, it's not because they don't feel convinced that this is going to be helpful for them or they need it. The hesitation is more like, how is this going to impact my work situation? How is this information perhaps going to be affecting me that I am seeing a psychologist? That is more the hesitation. And so that just illustrates also the amount of stigma there still is in our society at large on how dealing with your mental health is being regarded oftentimes.
In terms of now going from that clinic to the advocacy side of things, I know you've been a strong advocate for incorporating patient voices into behavioral health considerations and cardiovascular treatment. What are the biggest gaps right now that you can see in current care models, and what steps can we take as clinicians and also to communicate to the policymakers to create more whole person, patient-centered approaches?
So, yes, my early work that I did along with a whole consortium of vascular specialists in the country was supported by the Patient Centered Outcomes Research Institute, or PCORI, and their model was designed such that we included stakeholders from the get-go, even when we were starting to design the study, coming up with research questions. At every point along the way that we did research, we involved patient voices. And we have been doing it ever since. And so here also with the lab at Yale, we ask patients from the cardiology clinic to serve as experts for the programs we design. And as far as the work that is needed for advocacy, we need to do it along with our medical colleagues, the behavioral specialists, as well as the patient stakeholders together, which I think the networks that we formed for our research are good starting points to turn those into advocacy. And groups like the ones we founded for the American College of Cardiology, Cardiovascular Psychology Work Group, are one example to doing the advocacy work. And then also on the side of the American Psychological Association, have a similar group that I lead at the directorate level, where along with my psychology colleagues that work in integrated specialty care, we are starting to think about value-based care frameworks and really putting specifics in place on how these are sustainable and not sustainable if we use the traditional RVU model, and how then there can be offsetting of cost and how can there be value generated. So we actively think about those models of value-based care and put those out in reports that are coming out for the APA. And on the ACC side, we're doing similar things and have really cross-linkage between the two groups and see where there's synergy, where we can publish about these newer models of thinking. So I think access is a key element in the obstacles that we need to navigate. What I see happen in the clinical care setting is like some people need prior authorization, and that's like very challenging to get them to the care that they need. It delays the trajectory. Out-of-pocket cost may also be an issue for some insurers, so that requires separate negotiation with certain health plans. And then the reimbursement of these services is very low traditionally. So in a fee-for-service model, it's going to be challenging. So you need to come up with a way on how to work with the health system leaders on how to make this a sustainable program. So there's various entry points where we can make an impact, but first describing what the issues are and what alternatives could be, and raising awareness and organizing as professionals in a multidisciplinary way are good strategies, I think.
Yeah, absolutely. I'm glad you keyed in on some of the unfortunate financial aspects of things, but we do need to make these programs sustainable so that we can provide and scale for more and more patient access and care. So I'm glad you did raise that as an awareness point. I'd like to know if there's any impactful programs that you've done with your cardiology colleagues in your work group that you think has been very helpful and meaningful to you.
Yeah, I am most proud of what the ACC Cardiovascular Psychology Work Group has accomplished. This last edition of the ACC conference in Chicago, we had our second round of meditation workshop that we organized as a work group. And it was really near and dear to our heart to see that the enthusiasm for the sessions has grown. And we had two sessions. We had an active meditation and a guided meditation. And that people came forward and asked for more of this in future editions. And they all participated in it, even though perhaps they have not tried a meditation before. So it was something new for them to discover and to be able to share these practices with my medical colleagues. Yeah, that was a really fun way of introducing the balance between mind and body, and offering them some tools to try out for themselves.
Yeah, I think that's especially if this is the first time they've been exposed to it, they can see for themselves what you can offer to your patients and their patients. And, just as a very personal sort of thing, you talked about, decreasing that sympathetic stimulation, as I've done some meditation in my background, it's extraordinarily helpful. So that's exciting to hear.
Yeah, and to see their initial sort of awkwardness with like the concept of meditation, but then seeing that their colleagues are participating and getting over that hurdle, and then doing all the practices and reporting positive feedback. So yeah, hopefully we can get more cardiologists to engage in these practices for all of our collective mental health and well-being.
Great. Thank you so much. In closing, do you have any other pearls of wisdom that you like to share for our audience across the board, our clinicians, our physicians, psychology colleagues? What are things that you've seen along your journey that you can share with us today?
Well, one thing I was surprised to find is, and this is a historical thing to remember more so than something that I learned in the day to day practice, is Hippocrates really emphasized in his way of thinking about medicine the role of social determinants of health and the balance between mind and body. And so, always that has been the intent of the way we think about medicine. It seems like we may just have forgotten on how to give that a prominent place in treatments and the way we offer treatment to patients. So I'm hopeful that, yeah, we come back to remembering the importance of that. And it starts by cultivating this awareness for the connection between mind body as practitioners as well as providers, and modeling this to our trainees that no, it is not okay to forget about your mental health. You need to be proactive in that. And this is not something that is an afterthought. There's incredibly high burnout rates in specialists, and it reflects on how we organize the care for patients, and what we prioritize and model as to what is important. So I think it is a shared responsibility for all of us. And in the younger generations that we mentor within our group, we really try to emphasize that culture of multidisciplinary thinking and respect for each other's expertise and learning, and a growth mindset to really prepare them for this future where team-based care, I believe, is more the norm than the exception.
Oh, I love that emphasize that we need to care for ourselves before we can care for others. And if we expect our patients to care for themselves, we need to also care for ourselves. So appreciate that 100%, that's a message that we need to get across to our colleagues that are taking care of our patients. And so I appreciate that. This has been a wonderful conversation. So thank you so much for being here today and sharing your knowledge and wisdom about these important topics.
You're very welcome, and thank you for having me on this podcast. I really enjoyed it.
Professor Kim Smolderen has been our guest today. Please check out the episode description to explore all the resources mentioned in today's episode. Until next time, stay well.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series. stepsforward.org.